Hello, Professor Smith.
My name is Jamaica Chapman, and I am in your scientific basis of professional nursing practice. And on August 29th, I interviewed Amia Vaughn. She is a registered nurse who has been practicing for 2 years now in hospitals and home visits. When she was asked what is evidence-based practice in her own words, she replied and said that evidence-based practice is basically performing nursing duties that have been proven to be effective. When she was asked if she learned about evidence-based practice when she was studying nursing in her undergraduate, she said yes, and that evidence-based practice was emphasized on a regular basis. Nurse Amia said that she uses evidence-based practice a lot in her practice and states, for instance, when she is doing medication administration, she makes sure she washes her hands to prevent the spread of infection. Or if she is doing trach care, she knows to use sterile technique versus clean technique. One of the most interesting parts of the interview was when Amia was telling me about how the hospital she works at had an evidence-based project that actually changed a policy in the hospital. Apparently, it was mandatory to change the patient's IVs every 4 days. But then, her unit did some research and trials and found that it's better to change IVs as needed, because each time you change the IV, you risk the possibility of infection over and over again. I concluded the interview by asking Nurse Amia how important she thinks it is for me to learn about evidence-based practice in undergraduate nursing school. She responded by saying that it is important because at the end of the day, you're saving lives because it cuts down mistakes and infection. She also said that evidence-based practice is like a guide and a background for you to have a strong foundation on how to give patients adequate care. Thank you so much for listening and have a good day.